when you're born, you have clean blood vessels, beautiful blood vessels. When about teenagers, when small bits of plaque start depositing in your blood vessels based on the way we eat, the McDonald's, the Denny's, all the fast food, that plaque just gets deposited within your blood vessels. And over time, that plaque starts getting hardened up and becomes calcified, becomes raw, becomes really hard. And it's the calcified plaque is very difficult to reverse. It's almost impossible to reverse it because it's just really hard. But that's not really the cause for concern. It's the soft plaque that causes all the problems. The heart attacks, the strokes, it's the soft plaque that causes the most of the problems. That soft plaque, you can reverse it. And that's what Dr. Dean Ornish and Esselstyn have already shown. That soft plaque, you can reverse it with good food, with all the greens, the whole grains and all that. You can actually reverse that with food, with exercise, lifestyle changes.
Hey, y'all, it's Jolly with Interrupt Hunger's Move, Eat, Give podcast. I'm here to help you get back to your roots and live like our ancestors did, before ultra-processed foods poisoned us and before technology trapped us in sedentary, isolated lives. I interview experts in exercise, nutrition, and food insecurity, people who've transformed their lives through healthy habits, and community health champions building healthier communities, all to discover exactly how they did it and share those strategies with you. Our goal? Take these proven methods back to Bernie and make it the healthiest small town in Texas. Then share our blueprint to create healthy small towns all across this incredible country. Before we get to today's guests, here's how our Donate Your Weight program helps you celebrate weight loss victories, whether you're going solo or joining a team challenge. If you've ever said, I know what I need to do to lose weight, I just need to do it, then this challenge is for you. We help you turn your knowing into doing. The Interrupt Hunger 12-Week Weight Loss Challenge is a plan to help you lose weight by creating healthy habits in a fun and easy way. While you create new habits, we use compassion and community to help you stay motivated long enough for your new habits to stick. Bring the 12-Week Weight Loss Challenge to the places you live, work, and pray. Once a week, come together to exercise as a team in your neighborhood or at a local park. Then, once a month, come together to give back to your community by volunteering at a local food bank, food pantry, or soup kitchen. And finally, once a month, donate your weight to celebrate your weight loss victories. Donate at least $1 for every pound you lose to help fight hunger. 100% of proceeds benefit a food pantry in your area. You already know exercise makes you feel better. You already know the difference between healthy and unhealthy eating. And you already know it feels really good to give back. The Interrupt Hunger 12-Week Weight Loss Challenge helps you to be intentional about how you move, eat, and give, and helps you turn your knowing into doing. Visit interrupthunger.org to join as an individual or start a team. Contact us with any questions. We're always happy to chat. Hey everyone, Jolly here with Interrupt Hunger's Move, Eat, Give podcast. Thanks for joining us. Today, we've got Dr. Ajay Joseph, all the way from Tulsa, Oklahoma with us today. Dr. Joseph, thank you so much for joining us, sir.
Thank you, Bill. It's a pleasure.
Well, why don't you tell us about yourself and your practice to get started?
Yeah, I am an interventional cardiologist, and to make that simple, I'm the guy who you come to when you have a heart attack or when you have some chest pain. That's what I've been trying to do, put stents in for blockages in your heart, your legs, and all of that. But I'm more passionate about this whole field of lifestyle medicine, which is about 25 years old, but really touches on the root cause of what we're dealing as a country, as a health system, be it strokes, diabetes, heart disease, dementia, you name it. 85% of what I see in the hospital is from our lifestyle choices. And that's what I do part-time. 4 days a week, I put stents in and fix blockages, but 1 day a week, I teach patients how to cook healthy meals and exercise and sleep better and handle stress better. So that's me.
Yeah, that sounds fun. So on one hand, you're catching people at their absolute worst after they've made really a lifetime of unfortunate choices versus the alternative. So which one is getting more folks healthy?
I think it's the way I put it is that it's just, when I put a stent in, and what I show them is a picture of a guy mopping the floor while the faucet is open. So somebody has to mop the floor. I mean, you got to mop the floor, but you also got to close the faucet. So both have a place, right? There is a place for medicines. There's a place for tests, procedures, and all kinds of things. But I think what we tend to focus on is more just that. We just try to focus on medicines and pills and procedures, whereas while that faucet of disease, that's the food that we eat, the way we handle stress, the exercise that we don't do, and the poor sleep. That's kind of the main faucet that's overflowing, and there's a big part of that as well that needs to be addressed, and that's what we. So the point is that there's a place for both of those roles, and I try to meld both of them together in my practice.
So how'd you get started with lifestyle medicine? We're meeting more and more folks that are getting
Yeah.
certified. How'd you get started so early?
It's interesting. It started with my own personal health journey. I was training in Chicago back in 2015 to become a cardiologist, and I noticed eating the cafeteria garbage that I was eating in my hospital, my own cholesterols and my sugars were creeping up. And then I was almost about to start myself on some pills and for my cholesterol and for my sugars. And that's when I met my mentor, who is, I think, one of the few people who you might relate to. They change the trajectory of your career, your life, your everything, right? So his name is Dr. Kim Williams, and he's one of the founding fathers of this whole field of lifestyle medicine. He's a preventive cardiologist at Rush University, and I trained under him, and I was working with him for about 3 years, and I mentioned all these things to him, and he said, "Why don't we just think about your lifestyle? Why don't we just talk about what you're eating?" And then we kind of did a deep dive into what I was eating, and then of course it was quite eye opening, and then that led to me to the path of lifestyle medicine, and then I've never looked back since then. My sugars of course dropped, my cholesterol's dropped, and then of course I had to bring that up into my practice as well.
That's wonderful. So let me ask you. So this is a loaded question for you. Roughly, what percentage of the patients you see on the interventional cardiology side of your practice could avoid ever having to come to see you if they led a healthy lifestyle?
So it's a very nuanced question, right? In the sense, if you're coming in with a heart attack, right? If you're coming with an acute event, a heart attack where your blood vessel is completely blocked up, you have to, of course, go and open it up. But if you ask the question as how much of it could be prevented, up to 90% of heart attacks can be prevented. 90%.
90%.
90% of
So
90%. In fact, coincidentally, just last week, a study was released, I believe, in Land. It was a Journal of American College of Cardiology. What they did was interesting. What they calculated was, the American Heart Association has what it's called a checklist of all the risk factors. Are you eating healthy? Are you exercising? Are you sleeping well? And if you checked all the 8 boxes, your risk of a heart attack drops down by 88%, so close to 90%. So to answer your question, up to 90% of heart disease is preventable.
yeah, that's something. So I've heard you compare your clinic. I think you use the word roadblock or obstacles that other specialties are seeing and don't know what else to do. And you kind of went through a list, some of the common problems from other specialists. So we share that story.
Yeah, it's interesting because every specialty has a pain point that I say that is not being addressed or cannot be addressed, or they just don't have enough tools in their toolbox. For example, if you're diagnosed with fatty liver, right? That's one of the most common liver problems that we have. About 33% of Americans have some stage of fatty liver. And if you have fatty liver and if you go see a gastroenterologist, there are very limited options that they have. There are no pills. There are some pills that have just come up recently, but nothing well proven, long lasting, without any side effects and all that. So what they do is that they tell you to go home, eat healthy, lose weight, live a healthy lifestyle, and all of that. But then how do you do that? That's a pain point from a GI perspective. There's not much they can do about that. Similarly, if you're diagnosed with mild cognitive impairment, which is the first stage of Alzheimer's, that is again a stage where if you make some dramatic lifestyle changes, you can actually reverse the process. Same thing for that. That's a pain point. There's not much of treatment for that. There are some, again, treatments, exorbitantly expensive, $35,000 a year and all those things. But again, that's another pain point from a cancer survivorship standpoint. If you've survived cancer, if you've gone through cancer, there's a lot of data showing that if you live a healthy lifestyle, your chances of recurrence go down significantly. Your chances of a secondary cancer go down significantly. You survive longer. So every specialty similarly has what I call a pain point, which lifestyle medicine can fulfill.
So you're in Tulsa, which is on a lot of lists as being one of the worst.
Ground zero.
Yeah, in the entire country, not just the state, but in the entire country. I know that there's some folks that are really trying to make a difference. Like you're making impact, and Erin Martin and her outfit, making a real impact.
Just on a call with her this morning, right before this.
Oh, really? Oh, no kidding. Yeah, it's incredible. I'm sorry, just like random. Are y'all able to work together yet, or y'all have some plans?
That's exactly what we're working through. We're working through some logistics of how do we get both these things together. It just makes sense.
Yeah.
Intuitively makes.
Yeah, that's fantastic. So tell us. So can you think of a like a success story of one of your patients that came into you just a train wreck and scared, and their family scared, and all of a sudden you got a hold of them and
Yeah,
helped them make
yeah.
some changes.
I think one of the patients that I remember was from about 4 years back, and this is a gentleman who had a diabetes. He was diagnosed with heart disease, of course, in his 50s. I had a bypass, 3 bypasses, multiple stents, I think 10 or 15 stents, and his sugars were way out of control. A1C was 9.8 or something. And what happens is that when your diabetes is out of control, your stents just keep getting clogged up. Your bypasses just keep getting clogged up. That's what happens when your sugar's out of control. So he would come in every 6 months for a chest pain, and we would go back in, find a stent that's clogged up, and just balloon it again. And he would come back in again in 6 months. Again, his stents would be clogged up. And then one of his, when I first met him, was when I told him, I'm like, I'm going to do your ballooning again, but you really need to change your lifestyle. And I had him watch a few documentaries and give him a small little booklet that I have about food. And after this procedure, his wife and him, he decided, what, this is it. We're not going to be doing this every 6 months, coming back for these procedures, because each of these procedures have risks. Why would you want to do that? But he went and gung ho, changed the way he ate, started exercising, and that was the last time I needed to balloon a stent for him. That was 4 years back, right? And this is a guy who would be getting a ballooning or a stent every 6 months for the past 10 years he was doing that. So the point, and his story was so compelling that I asked him, can you come and share your story with my patients? So he would drive an hour away from here, Skokie, which is about an hour away. He would come every few weeks to kind of share his story with my patients when I do my cooking classes. So just to give him, make it more realistic, more human. So that's one story, and there are just numerous stories I've had of patients who've lost sugar with diabetes, better control, lost weight, fatty liver reversed. It just shows the power of lifestyle medicine.
So how does first off, I'll ask you like how it actually helps to reverse or treat, and then we'll talk about like what are the meat and potatoes of your clinic. So somebody with needing a stent, they need an interventional cardiologist. How does lifestyle medicine in your clinic actually reverse their disease?
So first off, I think we need to understand that when I put in a stent for somebody in their 30s or 40s or 50s, that blockage didn't start 5 months back or a year back. That started way back in their teenage, right? It didn't start in the immediate past or anything. It started way back. So it's a very slow building process. Plaque buildup is a very slow building process. Right. There are times when these plaque rupture, and that's what causes a heart attack. And that's when we go in, we just got the whole vessel shuts down. We got to go in and open it up with a stent. But the process of plaque buildup, it's a very slow process. Now, if you think about it, let's say you come in with chest pain, I put in a stent and I balloon the plaque up, the plaque all gets smushed to the side. I put a stent in to keep it open. If we don't change the basic process about how this plaque came on, that plaque just keeps building up within the stent. However, if we change the process, the first order of business should be to stop what's already building it up. Stop what you're doing, right? And then we push back on the plaque, right? We push back on that plaque with food, with exercise, with sleep, with stress, and all that. In fact, there is good data. There are actually just 2 people in the world who've actually shown plaque reversal, right? One is Dr. Dean Ornish at UCLA. He showed that 40 years back. 40 years back, he showed that you can actually reverse plaque with angiogram. He actually went in, did angiogram, then he saw plaque reversal. And Dr. Colwell Esselstyn at the Cleveland Clinic, again, same thing. He's shown plaque reversal with intensive lifestyle changes. So it's definitely doable, definitely has been shown, and it's been demonstrated. Just that we just don't give enough importance to that.
If you stop the injury, so you change, you're eating good, you're exercising, all this stuff. If you stop the continual injury, does your body just gradually remove the plaque?
The soft plaque. So I need to clarify that. But if you've got calcified plaque, the plaque starts off as soft. So the way I tell patients that when you're born, you have clean blood vessels, beautiful blood vessels. When as in about teenagers, when small bits of plaque start depositing in your blood vessels based on the way we eat, the McDonald's, the Denny's, all the fast food, that plaque just gets deposited within your blood vessels. And over time, that plaque starts getting hardened up and becomes calcified, becomes raw, becomes really hard. And it's the calcified plaque is very difficult to reverse. It's almost impossible to reverse it because it's just really hard. But that's not really the cause for concern. It's the soft plaque that causes all the problems. The heart attacks, the strokes. It's the soft plaque that causes the most of the problems. That soft plaque, you can reverse it, and that's what Dr. Dean Ornish and Esselstyn have already shown. That soft plaque, you can reverse it with good food, with all the greens, the whole grains, and all that. You can actually reverse that with food, with exercise, lifestyle changes.
That's beautiful. Okay, so tell us about your clinic. Yeah, tell us about the lifestyle medicine and how you help folks get healthy.
So we see patients in the clinic, and we see them for different reasons, right? GI refers their patients for fatty liver, neurology for cognitive impairment, diabetes, endocrinology, heart disease. My own colleagues refer their patients. We see them. We do an intake survey where we kind of do a deep dive into the lifestyle. What's your dietary habit like? What do you have for breakfast, lunch, all kinds of things. How much do you sleep? How much do you exercise? What's your level of stress? What's your level of social isolation? All kinds of things. It's a deep dive questionnaire. And based on that, we kind of formulate an individualized plan for each patient. Like, what's your priority? What is it that we want to fix over the next few months? We make a plan for these patients. That each of those visits are about 40 minutes, but I can tell you 40 minutes barely suffices, flies by. But 40 minutes, that's one office visit that we do. And then if we feel that the patient is really motivated to make some dramatic changes, we offer them a cooking program that we have, which is more intensive. It's more hands-on, it's more labor intensive. It's an 8-week program where I have patients come in as a group, 12 to 15 people in a group. It's conducted at our health facility, our gym facility, where I divide them into 4 pods. I have a chef who teaches them how to cook healthy, simple meals. Nothing fancy, nothing very basic, just building up culinary skills. I have a dietitian who teaches them the basics of how do you read a food label, how do you do grocery shopping, batch cooking, all different aspects of culinary medicine that we teach in the 1.5 hours. And there's a stress management session, there's exercise planning, there's a didactic, a lecture about how first is heart disease, what is it, the food that you just cooked, how does that relate to heart disease, how does that relate to strokes, how does that relate to cancers, yeast, and so on and so forth, kind of covering the entire gamut of lifestyle diseases. And so that's an 8-week, much more hands-on, much more intensive program. And then, of course, they see us as a follow-up after that as well. About 3 months after they complete the program, they see us as a follow-up after 3 months, just to make sure. The way I tell patients is that you want to look at this as a journey, not a destination, right? You're just starting this now, but you want to look at this as in a year from now when you come and see us, you should look back and say, boy, this is completely different from how I used to eat a year back, how I used to move, how I used to sleep, how I handle stress. Because we are living in this world where we want those instant results. Everybody wants instant results. They just don't last. Instant results don't last. Slow, sustained progress, and that's what we try to emphasize in our program.
So who's leading the sleep and the stress portion of that? Is that a dietitian also, or exercise physiologist?
We have a chef who does the cooking portion, and then after that there's a didactic that's run by a nurse, health coach, and then there's a 30-minute stress management session run by a therapist.
Okay. Oh, very good.
And then we have an exercise physiologist, of course.
All right. So what about in the near term, in the next couple years, how are you going to scale your program? Because this is fantastic right now, and getting it paid for is the tough part.
Yeah.
But how do you scale?
We actually right now. We just had this meeting this morning with a consultant. We're working with a consultant to kind of build a business plan. And I think the premise of lifestyle medicine is cost savings, right? It's not revenue generation; it's cost savings, right? And there are significant, profound cost savings from these measures, from these things that we're talking about. And being able to quantify those cost savings has been the biggest challenge, right? But there are ways of how you can quantify those cost savings. What's the cost saving of decreasing your A1C from 10 to 5.5, especially in a value-based care setting that we're in right now? So there are ways of doing that. That's exactly what we are trying to build in a business plan and kind of expand this program.
Do you have any advice for a motivated provider that is starting to hear more and more about these types of programs gradually pop up around the country?
I think the advice that I would have is to start small first, start very small. I mean, this has been a 5-year process for me. Especially in large health systems, if you're working within a large health system, you need to think that you are growing against the grain. So there will be a lot of pushback. There will be a lot of skeptics. There will be a lot of people who think that you're doing voodoo medicine, but you just got to keep going with it and just start small, keep building on small success stories, and then keep building on that and building that momentum. So starting small is one, and secondly is the thing is that you have to build a team of support systems within your administration. Right, you've got those success stories is what build that momentum within a health system. And last but not the least is what I've encountered in my case is if you're doing something that is so consequential, that is so consequential to patients' lives and their families' trajectory and all that, the universe will conspire to help you. I have no doubt. I've experienced that time and time again. It's not even a joke now. I'm like, so if you go on this path, you will find things just lining up for you.
That sounds like a pretty fantastic place to end there, sir.
Yeah.
That's wonderful. Well, thanks so much for taking a few
Of
minutes with
course.
us today. How do you're doing some really neat stuff? So how do folks follow what you're doing or get in touch with you?
Well, I think the easiest way would be I'm on LinkedIn. That's my only social media. That's my way of, and the only reason why I'm on social media is to promote lifestyle medicine. That's one. And of course, our website is as they're saying, just Google St. Francis Lifestyle Medicine Tulsa. You'll find all resources that are.
All right, very good. Well, Dr. Joseph, thank you so much. I appreciate it. Keep spreading joy. You're doing wonderful work.
Same to you as well, Bill.
Thanks a lot.
Be a pleasure. Thank you.
I know. Thanks so much for listening. Please rate and review the podcast on the platform of your choice so we can reach more people and more people are recommended this podcast. And if you really liked it, the single best way you can help us grow is by telling your friends. Now, for all the legal stuff. The views and opinion expressed in this program are those of the speakers and do not necessarily reflect the views or positions of any entities they represent. For my day job, I'm an employee of AbbVie and appear on this podcast on my own accord and not in the professional capacity as an AbbVie employee. All viewpoints provided are my personal opinions and not intended to reflect those of my employer. If you have any questions or comments, please shoot me an email at jolly@interrupthunger.org. Let's go spread some joy, people.